Hi, it's Brian Thomas from the 55KRC Morning Show with my Ask the Expert, Dr. Lewis Mayo. Dr. Mayo?
How are you?
I'm doing well. It's a pleasure to have you on the Ask the Expert today. And just a little recap of what we talked about today because it's so important. Dental hygiene is more than just about your teeth. I learned that in spades today. Tell me, if I don't take care of my teeth, what other problems other than tooth decay are going to happen?
Well, tooth decay is essential because that directly affects your diet. Also, the loss of teeth affects your diet. If you are on a high sugar diet, you're going to develop all sorts of problems.
See the diagnostician part of it. We talked about this today. He meets his patients in the office outside and shakes their hands, sees them walk into the clinic, into the surgery, so he can get a real good idea of their general health. So it's more than just the mouth. And as he's pointing out, you got tooth decay, your diet's probably bad. So he can figure out just by looking at your teeth if you're eating right, as well as whether or not you're brushing properly.
That is correct. A person who comes in, an adult who comes in with tooth decay, has something seriously wrong with the diet. Now, I had a patient this week. She came in, I took one look at her mouth. She had 9 cavities. I asked, "How old is your son?" She said, 5 years old. I said, "Stop eating his candy." Right? And she laughed because, you know, she said, "It's gummy bears." And
it's sugar.
It's sugar. It's right on. You know, and those kind of diagnoses are really very fundamental. It's not a question of you have so many cavities, your gums are so inflamed, you have so much of this, so much of that. It means something, and it means something in the greater picture of what the patient is doing in terms of their lifestyle. And the lifestyle fundamentally changes when a woman has a child and the food in the house changes over into something a little bit sweeter. It changes when a person moves. It changes when a person leaves their job, gets another job. They have a vending machine nearby that has lifesavers instead of chewing gum.
Yeah.
That's a minor fundamental change that radically changes your diet into something that is carcinogenic.
And everything adds up, and as you point out, as a diagnostician of someone who, in terms of disease states of the mouth, the impact on the body is absolutely amazing. Heart attacks, you mentioned.
Right.
You also mentioned ulcers, which I had no idea the mouth and the ulcers were connected, but the same bacteria can...
Exactly. In particular, Heliobacter is the bacteria associated with ulcer, and that is one of the bacteria associated with periodontal disease. Bacteria that live in the deep spaces where there isn't a lot of oxygen, and they get into these deep spaces and they do very well there. So they go from the mouth to the stomach. So
to take care of your entire body, take care of your mouth. And what do we need to do? We need to brush after every meal, right?
You need to brush, you need to floss, you need to rinse your mouth, and you need to see your dentist twice a year for an examination and x-rays.
Dr. Mayo, thanks for the time today. It's been a pleasure talking with you.
Thank you very much.